Geoffrey MALUKI's wife, Pauline, died from COVID-19 complications in March. A government isolation facility in Kitui in eastern Kenya, where they live, did not have enough oxygen.
My wife was suffering, so we decided to move her to Nairobi. We called so many hospitals, but they were full. When we finally got one, we had to quickly pay a down payment because 6 other people were on the queue.
In neighboring Machakos County, health workers take us to the intensive care unit, or ICU. All 12 beds have been occupied for a while.
When we get patients who also require COVID-19 ICU care, then we talk to the surrounding neighboring counties to see whether they have beds available.
The country's nearly 600 ICU beds fill up first, and demand for oxygen has almost doubled to about 800 tons. Government hospitals don't have enough, and health ministry officials say thousands of cylinders are being hoarded by individuals for private medical or industrial use. But there is some hope. This is the country's largest privately owned steel factory. It has stopped all production, losing about $30,000 a day to provide the oxygen to hospitals for free.
Hundreds of hospitals and health centers get their oxygen from here. About 1,000 cylinders are filled up with the gas every day for supply. But even that is not nearly enough to meet the demand.
One patient is taking almost 3 cylinders of oxygen every day. And it is impossible for any hospitals to cope up with this demand.
To avert the total collapse of the healthcare system, the government wants to reach herd immunity to the disease through vaccinations as quickly as possible. Nearly 1 million people have so far had their first dose of the UN COVAX distributed AstraZeneca vaccine. But the supplies are running low, and there's uncertainty about the availability of AstraZeneca for the second jobs. Machakos Hospital has vaccinated about 12,000 people, but authorities are concerned about those falling ill and dying in rural villages.
So what have we done? Now we've required that every person who dies in Machakos has to be tested for COVID, because people are falling dead. Some of them may fall dead at home, especially older people.
Back in Kitui, MALUKI tells us he wants the government to provide facilities for patients who cannot afford private hospitals, so they don't go through the same trauma his family did. Catherine Soy, Al Jazeera.